Hello viewers, in today's video we will talk about median nerve. Median nerve is part of the big four neural branches of the brachial plexus along with radial nerve, ulnar nerve and musculocutaneous nerve. Median nerve is a frequently asked question in MRCS Part A, so let's highlight some important aspects that you should remember about the median nerve. Median nerve, as I said, is an important branch of the brachial plexus. I've talked about brachial plexus in detail in a different video. Please feel free to check that out. Median nerve is formed by the union of the lateral root of lateral cord and the medial root of medial cord. In the beginning of its course, median nerve lies lateral to the brachial artery and then it crosses the brachial artery to lie medial to it. Median nerve does not give any branches in the axilla or in the arm except the articular branch to the elbow joint. Median nerve enters the forearm between the two heads of the pronator teres muscle, the ulnar and humeral heads of the pronator teres muscle, and median nerve lies medial to the medial supracondylar ridge. Median nerve starts giving branches in the forearm. Median nerve is largely responsible for providing nerve supply to almost all the muscles in the anterior aspect of the front of the forearm, and some muscles lie in the superficial plane, some lie in the deeper plane. Almost all of these muscles are supplied by the median nerve. So let's talk about them one by one. In the superficial plane, median nerve provides muscular supply to the pronator teres muscle, flexor carpi radialis muscle, palmaris longus muscle, and flexor digitorum superficialis muscle. For the deeper plane, median nerve gives out a branch called anterior interosseous nerve, which lies in close relation to the interosseous membrane, which is a membrane between the radius and ulnar bones in the forearm. Now, this anterior interosseous nerve provides muscular supply or motor supply to pronator quadratus muscle, flexor pollicis longus muscle, and the radial half or the lateral half of the flexor digitorum profundus muscle. Now, in the forearm, median nerve also gives out a palmar cutaneous branch, and I've talked about the cutaneous supply or the how sensation is perceived from the skin of the upper limb in detail in a different video. So we will not talk about the cutaneous branches in this particular video. So this is the median nerve's role in the forearm, and then median nerve enters the hand through the carpal tunnel. Once median nerve has entered the hand, it gives a recurrent branch which supplies the thenar muscles, that is flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. And median nerve also supplies the first two lumbrical muscles, which are important for the index finger and the swear finger. On the right of the screen, you can see a cutaneous supply, that is how the median nerve is responsible for perception of sensation from the skin of the hand. You can see on the upper side, you can see the front of the hand, and on the lower side, you can see the back of the hand. So this is the sensory and motor function of the median nerve, and I've described the course also in brief. Now, a very important question related to median nerve is carpal tunnel syndrome. So let's talk about that as well. Now, as you can see here, this dotted line on your left shows the level of the carpal bones. Carpal bones lie in two rows, the proximal row and there is a distal row, and each row consists of 4 bones. They form a tunnel roughly at the level of the line drawn here. This tunnel is between the bones and a flexor retinaculum. Okay, so this tunnel contains 9 tendons. You have the 4 tendons of flexor digitorum superficialis, the 4 tendons of flexor digitorum profundus, and the 1 tendon of flexor pollicis longus, along with the synovial sheaths. Now, these structures usually are not at risk of compression during carpal tunnel syndrome. So what is carpal tunnel syndrome? Carpal tunnel syndrome is when the carpal tunnel gets compressed due to swelling in the carpal tunnel. Now, the only delicate structure, the carpal tunnel, which produces symptoms is the structure drawn in yellow here on your screen. This is the median nerve. Now, if there is median nerve compression, which is also called carpal tunnel syndrome, median nerve compression at the wrist, which is called carpal tunnel syndrome, it can produce numbness over this area shaded in pink on your screen. So there will be numbness or tingling sensation, or typically described as feeling of pins and needles in this uh, in this part of the hand. Okay, so this is carpal tunnel syndrome, which is due to compression of the median nerve in the carpal tunnel. It can be following trauma, or it can also be following a prolonged work related to typing or writing, perhaps. So, prolonged wrist work. Even some video game players get carpal tunnel syndrome. So, I hope you liked my video on median nerve, and if you have any questions, then please feel free to reach out. All the best for your exams. Take care. Bye bye. And please don't forget to be awesome.